There's no bed like your own. And if you suffer an illness or an accident, the last thing you would want to do is recover in an unfamiliar, hectic environment like a hospital or nursing home. Focus on your recovery in the comfort of your own home with a Home Healthcare Shield short-term home health care insurance policy from United National Life Insurance Company of America. Think about your family's situation. You may be reaching that age where planning for future care is necessary, or maybe your parents are reminding you that they don't want to go to a nursing home. How could being unprepared for either yours or your parents' need for care affect your finances and way of life? UNL Home Healthcare Shield is more affordable than many other plan of care policies, and it pays benefits directly to you, regardless of any other insurance you have. Home health care benefits kick in if you suffer a cognitive disability or can't perform 2 of the 6 basic activities of daily living, and no hospital stay is required. The base plan consists of 3 main components, and there are 3 different base plans for you to choose from to match the level of coverage you want. With the home health care benefit, your chosen plan pays a benefit for up to 360 days for a variety of services, including skilled nursing, physical therapy, and general nursing care. With our most comprehensive plan, you can receive up to $162,000 of home health care benefits. With the Healthcare Aid benefit, you can receive a daily benefit for each day you require the services of a home health care aide, depending on your chosen plan, and no hospitalization stay is required. Most likely you're taking at least 1 prescription medication. With the prescription drug benefit, you can receive benefits for any prescriptions that are filled after the policy is in effect. Just filling your normal prescriptions can help offset the cost of the policy itself. Now let's see how it works. Say you're 65 years old, have the Plan B policy, and take 2 brand name prescriptions that you refill every month. A UNL Home Healthcare Shield insurance policy could pay you a total benefit amount of $600 over the calendar year. With an annual policy premium of $568.92, this prescription benefit could more than offset your annual premiums, and this is not even including any home health care benefits you may receive. UNL Home Healthcare Shield is flexible and customizable, with a great set of riders for you to choose from. And with only 2 or 3 underwriting questions, you don't have to worry about a long application process or medical exams. So, for a fair premium, wouldn't you rather receive professional care at home? Now is a great time to find out more about UNL Home Healthcare Shield.